talking about infections, viruses, vitamin D levels, and how to stay healthy. I've got some brand new research that just came out that I want to share with you on how vitamin D can help protect us from infections. So, it's been known for quite some time that vitamin D it helps to reduce the risk of influenza and viruses with supplementation. And we know that viral infections often are going to occur in the wintertime, okay, when those vitamin D levels are at its lowest. So let's just talk about why vitamin D levels change during the wintertime, okay? So looking at the horizon right here, we know that during the summertime, the sun, it peaks higher in the sky. But in the wintertime, that changes and it's not as high depending on where we are in the globe. So with less sunlight, the average person living in that area is going to have less exposure, meaning that their vitamin D levels are going to drop, because we know that sun exposure reacts with our skin and our bodies are able to produce vitamin D as a result. So talking about supplementation and blood levels of vitamin D, okay? A normal, healthy level that we want to look for is between 40 and 60 ng per milliliter, okay? 40 to 60 is very important. And they did a comparative study, okay, where they looked at a observation done from 2009 to 2010 that included 198 healthy individuals to see if they demonstrated a risk for developing infections of the upper respiratory tract. And they showed that only 17% of individuals who had a vitamin D level of 38 or higher developed an acute upper respiratory infection, compared to 45% of individuals whose vitamin D level was less than 38. So that equates to about 3 times the health protective benefits of having a level over 38. So very, very important factor that we learned through that study. And the study that was done just this month actually looked at vitamin D levels and supplementation of patients in an ICU unit, okay, where they were on ventilators because they had upper respiratory infections that have gotten very severe, okay? So the average level that they had was 21, okay, so not very good. But they supplemented 250,000, okay, units or IUs of vitamin D in these patients, and they were able to decrease the length of their hospital stay from 36 all the way down to 25 days. So 9 days, actually 11 days, just by supplementing with some extra vitamin D. And then they also did a study of individuals where they supplemented with 500,000 of vitamin D. And that reduced it all the way down to 18 days. Pretty significant, okay? So vitamin D, in this case, was shown to significantly increase hemoglobin concentration, which is in our blood, which helps fight off infections, and that improves the body's ability to transport oxygen. Oxygen is vital for cell function and for cell healing. And some of the other things that vitamin D does just in general, it's going to help the adaptive immunity of our bodies, because those vitamin D elements are used to make and fight off those foreign invaders, as well as they help maintain what is called tight junctions and gap junctions. So let me explain to you what tight junctions and gap junctions are real quick. So we've got our cell. We're going to zoom in really, really close here, okay? let's say this is our cell, all right? And these gap junctions are little tiny places in between of each cell wall. And this is where the nutrients like vitamin C, coenzymes, vitamin D is able to enter into the cell, give those necessary components that help to boost its function. And we also know that this is the same mechanism that viruses use, okay? Let's just say this is a virus right here. It's going to try to get and squeeze through those tight junctions and those gap junctions in order to mess up and replicate its own viral DNA. And then it's going to get packaged into new viruses, so it's going to replicate itself, and then it's going to move on to the next cell and try to break in through those tight gap junctions. So the vitamin D helps maintain those tight gap junctions, making it so tight, so condensed that those larger viruses cannot break the barrier and get those cells sick. So what I'm going to recommend, okay, and what is the normal recommendation for a maintenance type phase, okay, let me erase this real quick, is going to be a simple amount of 10,000, okay, IUs a day of vitamin D, okay? And that can also be reduced to 5,000 after a couple weeks, okay? Everyone's going to be different, but this is just a general recommendation that can help us if we're at risk. Say you're working around people, children, family members who are sick, and you want to stay healthy along with getting your adjustments that we always recommend. You can do a maintenance type phase of 10,000 for say 2 weeks, and then you can reduce down to 5,000 IUs per day, okay? And then of course we always want to be monitoring our vitamin D levels when we get our blood work done, so we want to request those numbers to make sure that we're sticking within that 40 to 60 level. So I hope you learned something today. Let us know if you'd like this research. We can always get this to you. See you later.